Okay, good afternoon, everyone. Thank you for being here. In our oversight and accountability section this afternoon, we are going to take up Act 76, which is our landmark legislation around Child Care Financial Assistance Program, and really doing a overhaul of that program a couple of years back. And so it's time to take a look. You might recall we've had some testimony earlier this year from Building Bright Futures around their monitoring efforts with Act 76. And today we're going to hear from the Department for Children and Families around their efforts. And we are also going to try to understand what's happening a little bit on the federal stage and where we are in preparing for the currently at federal rules. Who knows if they'll change in the future. This afternoon, we welcome Deputy Commissioner here and Megan. Did I say that right? No, some say Megan, some say Megan. Yeah. So welcome to Human Services today, and we'll do some introductions. So Teresa Wood here from Waterbury, Bolton, Bealscore, and Huntington.
Ray Garofano, Essex and Essex Junction.
Jubilee McGill, Bridgeport, Middlebury, New Haven, and Woodbridge.
Hello, I'm Zon Eastis from serving Guilford and Vernon.
Good afternoon, I'm Bob Muncey, represent Brandon Farmstead.
Doug Bishop, I represent Colchester, Chittenden Twins.
Brenda Steady, East Milton, Westford.
Good afternoon, Eric McGuire, represent Rutland City.
Good afternoon, I'm Dan Noyes. I represent Woolkit, Hyde Park, Johnson, and Belvedere.
And we go all the way around the outside, starting with Dr. Crosby.
Hi, all. I'm Dr. Morgan Preston. I'm the Executive Director of Building Bright Futures. My name is Lee Lauber, and I've been an early childhood advocate for 50 years. I'm here to listen to updates for today.
I'm just going to interrupt just for a moment because Lee sat in this room for many hours during our many childcare debates and discussions. And so it's actually just great to welcome you back, Lee.
I'm Alice Berglis. I'm a policy advocate with the ACLU of Vermont.
I'm Peter Diorda, I represent here.
Matt Levin, Executive Director of the Vermont Early Childhood Advocacy Office.
Sarah Kenny from Let's Grow Kids.
Action Circles. One also will be technical.
And I'm Lori Morse, Committee Assistant.
Great. Thank you both for being here, and I'll turn it over to you to introduce yourself for the record. And we do have presentation on our website for those who are looking at their computers and anybody online who wants to look.
Hi there, Janet McLaughlin. I'm the Deputy Commissioner in the Department for Children and Families that oversees the Child Development Division. And the Child Development Division oversees sort of all things childcare, children's integrated services, and we partner with the Agency of Education on universal pre-kindergarten. So I got to talk to you guys last week, maybe it was 2 weeks ago. 2 weeks ago, okay. And I have with me
The record Megan Smeaton, Financial Director of DCF.
Okay, great. And so I have a lot to share with you guys, probably more than the time that we have. And so I'll look to you to help guide me on where we should spend more time or as we go. But I'll get started.
But we knew there would be a lot, so you get 90 minutes today,
Okay.
not the hour. So
Okay.
we do an hour for O&A, but you get 90 minutes.
Okay. So I can share my slides so that I make sure I'm looking at the same things you guys are. Here we go. Okay. Okay. Wonderful. Okay, so I think the charge today is to talk about some of the progress that's been made since Act 76 was passed, and then also to talk about some of the changes from the Child Care Development Fund, which is the federal rule that oversees childcare nationally.
So Jan, I hate to interrupt first off,
Yes.
but that looks like a different version than what we have.
Oh, is it?
We don't have anything that says CCDF changes, so I'm just, actually, this says April 19th, 2024.
Oh, darn it. Okay. Well, let me stop and resend. Sorry.
We can follow along
So you want to,
Yeah, I just want to make, I want us to be able
to
to.
be able to see.
Okay.
okay, I'm so sorry.
Yeah, because I can't see that. Yeah. Screen from
Okay.
last year.
Um, Sure, it was me who didn't maybe hit save and then sent, not quite the right version to our.
Same picture.
That's what we recently.
That, yeah, that would be last year, so something from last year. Okay, that's the name of the version I thought I was working from, so I don't know what I did. Okay. Sometimes the names look very similar on the documents on account of its Act 76 update for HHS. So let me send this to Lori and she will get it over to you. Or it's being sent as the PowerPoint itself, not as a PDF.
Okay. And then it'll be posted, so go ahead.
Okay. Okay. So. Should it get sent before I. close?
Steve, I don't think anybody's going to be here, so you're welcome to sit there if you'd like.
Thank you.
Okay. So, yeah.
There it is. Your committee, you'll be able to refresh in a little bit. You'll have that on your own screens. Okay, thank you.
Thank you. Sorry about that. Thanks for noticing so that we're confused a little later. So again, this is what we're going to talk about today. I'm excited to talk about with all of you. Just as the refresher, right? Act 76, right? Huge bill, many elements to it, rolling out over the course of the bulk of it rolled out over the course of about 18 months. And there still are elements of Act 76 that are, that have not yet been fully implemented yet. But right, the law primarily used the child care subsidy program. Child care financial assistance was the main vehicle for driving change in the child care system. But also were elements of the bill that were addressing, or the law that are addressing quality, capacity, and inclusion within early childhood education and after school settings. Obviously, it addressed funding, and there was the payroll tax. There were a number of changes that were related to sort of accountability, administration. You heard from Dr. Crossman and from Building Bright Futures before, right, who are our partners in monitoring the impact of the bill. In addition, this accountability administration included some reports that we needed to write, as well as some additional staff for DCF and CBD. And then there was also obviously a big section of the bill related to pre-K, and I'm not planning to touch on that today since we spent a lot of time on that earlier. As we get started, I do just want to shout out the Child Development Division team and really the DCF Business Office for all of the work that they've done to really move a really dramatic amount of change through in a relatively short period of time. People worked really hard. They really got creative, really thought strategically about what was about how to layer the different pieces of the work together, how to have them build upon one another. So I just really want to appreciate my team for that. And again, our partnership with the business office was also a huge part of the success that we've seen so far. So in these slides, you'll sort of see that I have sort of check marks and check boxes for us to sort of follow along with what's been done and what is sort of still to do or is next up. Expansion of income eligibility for families was a huge, was a signature part of the law. As of October 6th, families can be eligible for childcare financial assistance with incomes up to 575% of the federal poverty level for a family of four. That could be about $180,000 in gross income for the family. And it does make Vermont have sort of the most financially inclusive childcare financial assistance program in the nation. There was the $0 weekly family share was extended from 150% of FPL to 175%. And then just so you know, we have one more, we have another annual change that is coming up. It'll be with the service period that starts March 23rd. We'll be updating the income guidelines for the 2025 federal poverty level. And when we update the income guidelines, that means we need to do like a mass redetermination process and send out certificates to anybody who changed where they were on the income guidelines. So maybe their copay has changed. And then that means that changes how much the state is paying the programs. And so there's a whole process. The technology takes care of it. But as you know, there also are little places, often a little bit of cleanup there. So that will happen in March. And that is something that was put into law actually in 2021.
Did you go ahead and send the updated
I did.
presentation?
Did not make it to you?
That's all right. Yeah,
Okay.
yeah, I did double check.
Let me see. Sorry.
That's okay. Just keep going. I'm sorry. I just want to make sure.
In my part of my outbox. Don't. I am on the internet. It doesn't seem to be. It's in my sent messages.
Okay, if it's there, it'll eventually make its way here. Maybe it's just because maybe it's a large file or something.
I could save it as a PDF real quick.
Yeah, it's okay. It's all right. I just want to make sure you had sent it.
I did. It's in my sent messages,
Okay.
not in my outbox.
Thank you.
Um,
It's out in the ether. Ether.
Okay. Okay. And then there was additional eligibility requirements that have been updated. So one was there was removing citizenship and immigration status as a criteria. Sort of how in Act 76, the question had been sort of there's some families who were seeking asylum, and there were some other sort of categories that weren't eligible from a federal standpoint, but we decided as a state we wanted to make sure that those children were in safe places while their parents were working. And so the way that ended up getting handled is we just sort of said, actually, that's not a criteria for us anymore. And we do ask for some of the information so that we can have some people get billed to the federal government, and otherwise we cover the other folks with the state. We streamlined the process for families who are connected to refugee and asylum assistance. So again, we didn't want to make it just possible for those families to receive a service on paper. We wanted to make it actually realistic for them to use the support networks that they already have in place to be able to manage the process of applying. We also expanded the education service need to include those who are working on credentials beyond an initial bachelor's degree. So in the past, if you were working on your MSW or you were in medical school, we would say, oh, that doesn't count for childcare financial assistance, even though there have been people training for jobs that we know are really important to Vermont. And so we expanded the definition of what kind of education qualified for as a service need for childcare financial assistance. We also did do some updates to our to the employment section as well to streamline the verification process that was needed, the verification process for employment. And next up is the self-employment policy, and we're aiming for that by May 1st. That is definitely it's a more complex policy because the paperwork and the kind of documentation people have is really varied. And we also we wanted to make sure that any changes that we made didn't, right, have unintended consequences of, we are in the final stages of developing that policy. So and then translating that into what is actual the guidance, training the eligibility specialists on it. And then it should be able to go into effect at the beginning of May. And the team really took this as an opportunity to make sure that our childcare financial assistance guidance is really strong. So far, we've revised 17 of the 28 childcare financial assistance policies overall, including just making sure that the language is really strong and clear for all the eligibility specialists, since there's just so many more families impacted now. In terms of other enhancements to childcare financial assistance, there was an additional $2 million annually for childcare financial assistance eligibility specialists at the community childcare support agencies. So that's how eligibility is handled. It's not handled by state of Vermont employees. It's handled by community-based organizations that we train and have access to our systems, but are already typically organizations that are already really focused on serving young families with children. We launched an online application. It went live on September 7th. We were slightly delayed on that, but we got it done finally, which has been something that everybody has wanted, including CDD, has wanted to get done for years, and it is finally done. And so far it's been over 1,500 applications, and it's about 1/3 of the applications that we're seeing come in right now are using the online portal. And that's seeming really, I guess there's sort of a lot of promise with that. It seems like we're learning, we're looking at it closely to see what we can learn. It seems like processing time seems to be quicker for online applications, but the success rates with paper applications is higher. And so I think we have to like study and look at that to try to understand, is it just a different group of people that are applying? Why is that? But we're looking at that and learning from that so that we can make sure that our practices are strong.
So can I ask a question? So when you go to your website and you look for the applications, it only comes up as a PDF or Word document. How do you access online? Do you have to do that through the childcare support agencies?
There is a spot online where you have to log in. So right, you have to create a profile in the childcare development information system to be able to apply. Because again, it's a secure system. You have to be able to, you're entering in.
Well, that makes sense. So
it should be on our website to be able to say, there's 2 ways to apply online, and then it should say, click here, and then you have a way to log in, and then, or it says, or paper application.
Okay, all right, well, I'll look around more.
Okay, no, that's good to know. That's good feedback. If we don't have it right, we want to fix it.
It's not obvious. I'm just
Okay.
saying that it's not obvious.
Okay.
But I will say, it is, even the paper application, or what looks like, something you can print out to mail in, is a huge improvement, 1, over what was, and 2, over what exists in economic services. They could learn from you.
Yeah, I mean, it's Japan, right? Because it's only a single program, right? We're able to refine our questions to what we really need. But yeah, the team did that. I didn't put that on here, but yes, we did refine the application in and of itself to make sure that the information we were asking for was just what was needed, and tried to make sure that the design was more easily readable.
Yeah, I mean, it used to be like 20 pages.
Yeah.
Oh, great.
Chair, may I ask a question?
Yeah, I'm sorry, go ahead.
Is there a way tell who is submitting applications online through the portal? And by that, I mean, I imagine some people may get assistance in filling out the application. So do we know if those who are helping others navigate are using this more heavily, or individuals using it?
So I think I understand. So for the online application system, it is CDD staff. It is a select group of CDD staff, and then the eligibility specialists who have access to the online, to sort of the back end of the application process, and they can provide that case management and support. But there's not sort of if it was So those are the people that can access the online application from that perspective. Families go on and they can access the parent portal, but in terms of being able to access sort of the eligibility specialist type content.
But the 33% that are now being submitted applications via the portal, are all parents doing it on their own, or are there some who have advocates or people within childcare support?
I don't,
agencies?
we don't have a way to capture that information
Yeah.
if it's not done. I mean, as far as we know, it's submitted on by the parent.
Yeah. Okay.
And which it has to be, at some level, it has to be because they're signing off and
Sure.
saying.
Okay.
the motion.
Thank you.
But we don't ask that question of who supported you in filling out this application. Eligibility specialists, if they're creating the application, it's that we know, but not if it's somebody who's not officially in our system.
Okay.
I was going directly to the place where it said forms for families.
Oh,
And it's not
Interesting.
there.
Oh, well, that's interesting though. That's interesting for us to think about how to.
I mean, the PDF is there, but
Yes.
forms for families has no reference to
Yep.
registering or accessing it on it. And my lovely vice chair is able to
Who's
navigate
very
me to where.
familiar with the
Yes,
website.
yes, was able to navigate me to the
Yes.
place where I should look. However,
And that's good to know that that's sort of the way you think about it. And we could think about what we need to put
okay.
at the top of the form of that. Okay,
So-
I will,
Right.
yes.
Yeah.
No, it's.
I just wanted to know it was much better than it was. That's all.
Yes, and right, again, I think, right, like if 33% of the applications are processed that way, then some
Somebody's
people are finding it.
Right, that's right. Somebody's
finding
So, okay. We're good? Okay.
Yeah.
So, and then we also have expanded promotion and communication out to families. And so the initial outreach started with press releases, newsletters, emails to parents and programs, front porch forum posts. So we did that in April and August and in October. And then we began paid promotion in a little earlier this year. And that included social, digital, streaming, and some broadcasts. So hopefully people have seen that out in the wild. Oh, well, if you haven't seen it, then they know that you don't have it.
I saw it and I definitely don't have to.
Anyway, my work. So.
Yeah, go ahead.
So,
Rip.
is there, you're probably not yet starting to track whether or not how did you hear about us kind of thing?
Yeah, so we do have, there's a couple of things happening there. So one, we will have, we will be able to use the, there is some tracking associated with the advertisements and things like that. So we have to understand click-through rates and things like that and work with our vendor to understand what's working there. We also do have a research partnership with Child Trends, and we're also, and BBF is part of that as well, along with CDD. And they're going to be doing some surveys of parents, and that will be one of their questions is about how did they hear about it. The research they did 2 years ago told us that the main way that parents heard about it was word of mouth, and really from their childcare providers is how they mostly hear about it, which makes sense. And many childcare programs have been very active in promoting this program to their families because they know that affordability is, something that they deeply understand as well. So I wanted, so these are some of the images that are in the promotional campaign and putting the final touches on sort of a digital toolkit that we can share out with partners. So for others who want to do their own social media posts or put it in their own newsletters, that should be finalized in the next couple of weeks. And then we also have posters that have like a tear off and brochures that should be mailed in March. And those will go out to all childcare programs. It'll be going to libraries, some pediatricians' offices, WIC offices, just places where we know young families are. And there'll be a way for people to request those from us as well. If you know of places where you think it would be helpful to have that information. So, and I will say that the volume, my understanding from the eligibility specialists is they really did get a lot of people jumping in right after each of the income changes went into effect. And so actually having this promotion campaign be a little bit later after they could catch that initial pent up demand, I think it's going to end up being decent timing. Did the slides make it to you yet, Lori? Are people?
No,
Elmhorst at.
I just got the one you sent me.
Oh, you did?
So, yeah, it's just a basic.
Do you want
chapter.
I did send it out. Did you want to put it in PDF?
Yeah.
Thank you, sorry. Okay. Okay, so this chart looks good, right? Even from far away.
I'm just saying, even from far away, yeah.
So it starts it as good when it's climbing.
Yes, it's good to be climbing, right? This is the average number of children receiving childcare financial assistance by state fiscal year, right? So looking back at 2017, going to 2025. Obviously, we're not fully through 2025, so this only, it uses the 6 months, the first 6 months, but obviously you can see that while there was this big COVID dip, we are way back above it in terms of participation. So
This is children, not families.
this
right?
one is children, yep. I don't think I have some slides on families, but I don't think I've stuck them in this presentation. And let's see, I think I got it right one. Okay, this one might be harder to read from far away, so I apologize about that. Okay. Okay, so this one is over a shorter period of time. So each of these bars is a quarter. So the quarter to the left is the start of state fiscal year 23, and the one all the way to the right is October through December 24, right? So it's the other one, right, was multiple years. This is a shorter period of time. But wanted to include this so that you could see it. And also there's a little bit of variation by quarter depending on, because summers usually have higher participation. So wanted to add some of that history in there. And the green is infants, the yellow is toddlers, the orange is preschoolers, and the gray is school age. And they are, and so you can see, obviously, again, the chart from far away, you can see it's higher on the right side in terms of the number of children who are participating. And it is, if you compare, there's a 42% increase between sort of the last quarter of 24 and the last quarter of, what did I say that was? 23. And we're seeing the greatest increases in terms of participation in infants and toddlers.
So I have a question about
Yeah.
that because how do you know? So obviously there was some pent up demand.
Yep.
That is continuing to be met, and
Mhm.
I think we'll still see some increases happening as more people find out about the
Mhm.
changes in income guidelines and things. Where do you believe we are at in terms of meeting the demand?
I don't. In terms of like all families being able to find a spot that works for their family, that they can afford.
Right, I mean, the goals were to increase accessibility, affordability, and access. You
Yeah.
know, those were the three things. And,
Right.
I mean, we're obviously seeing, affordability has increased because
Yes.
the assistance has increased, and access seems to be increasing because we're, seeing 3,000 more kids in childcare than there were just over that 1 year period of time. But I don't know about accessibility, I
Right.
don't know,
Yeah.
are we,
Yes.
at 80%? Are we at 70%? Are we at 90%? We hear different numbers. Let's just say we
Yeah.
hear different numbers, so advocates will tell you one thing. And so it's actually really good to see that access for infants and toddlers is increasing, because we don't always get that impression.
Yeah. Well,
Doesn't mean that it doesn't need to increase more, but there was a specific focus on infants and toddlers. So,
Well, this is affordability specifically, right?
Yeah.
We just know that
Yeah.
more children in that age group are accessing childcare financial assistance. I will say this is a place where I think what we know is just directionally, we're heading in the right direction, but we don't know where the end of the line is still, and that requires more analysis. And I think that the research that we're doing with Child Trends, again, they're a national research institution, they're doing this with other states, will help us begin to answer that question. And also some of the federal changes are requiring this state to do some more supply and demand analysis, which is not a thing that we have necessarily done before. So that's something that we're working to get into place right now. So I don't know. All I can say is we're heading in the right direction. Yeah.
Go ahead.
And so I was thinking along the same lines. It seems to me that do we know the population of these folks? I mean, just in Vermont, we know what a population is. And we
Yeah.
probably know something about some sense of which of that population is in need.
Yeah.
So this would be, you could compare those at some level.
You
and
can.
get a
I
sense.
think the trick, one of the tricks that I think nationally people are grappling with on the data is whether or not parent preferences related to childcare have adjusted, especially now with more people working remotely. And so it's a really hard question to answer exactly how much childcare people want and how many hours and does the system match up? Because also and I've got other slides on capacity, and what we count is the number of spots that are licensed. We don't have a great way to say, are all of those spots staffed and serving children right now? And I think that's something that, again, as we as we improve our data systems for within the Child Development Division, that'll also support us in being able to do some more of that analysis. Right now, the data system that supports our licensing is really out of date. We can't update it. And so that means we can't refine our questions essentially and get a little bit more specificity about some of the actual, like around who's actually being served right now and how many spaces are really out there. So I wish it were, I know it seems like a simple question and
I get that it's more complicated.
Yeah.
Rep. Garofano has questions.
I can follow up. to
Okay.
that. Just kind of thinking about anecdotally, we hear a lot about how the workforce is still a challenge.
Yeah.
So how is that related? And you don't have to answer this now. I
Yeah.
know. So we hear a lot of like classrooms are empty. You touched
Yeah.
on that, that have,
Yeah.
centers are open, but they can't open all the rooms that they need to because they can't get the staff. So especially in infant and toddler, because
Yeah.
the ratio's there. So just kind of thinking about that, how is that impacting the need and access? Would be interesting to kind of be following. I know you're doing some.
Yeah, absolutely. It is. And I would also say like workforce data is another place where the state doesn't necessarily have, these are 1,000 separate businesses essentially. And so we don't have, an aggregated data system that allows us to collect all that information. I don't know if we will ever want that. And instead, maybe it's just research studies, on a periodic basis that are going to help us be able to assess that. And then when it comes to workforce stuff, it's also tricky to disaggregate how much of this is specific to the childcare system and how much of this is just related to the workforce challenges that are in Vermont in general.
Thank you. And just for members, we do now have it posted on our website. So thank you.
Oh.
We do? Okay.
Okay. Rates. So that was another big focus for childcare financial assistance to increase the amount of money that the state pays on behalf of families that are eligible for childcare financial assistance. So all of the rate changes that were in Act 76 have been implemented. They were all implemented on time. A couple of them were even slightly ahead of schedule. So again, so now, these rate changes are so some of the changes we made were to just increase the base rate overall. Some of it was removing the tie to the STAR system because we want every program to have the funds that they need to be able to offer high quality care. And some of it was tied to what type of program it is. It was a center-based or a family childcare program. And so programs have seen rates increase somewhere between 35% or 150%, depending on exactly which kind of program you have. So it's been a very dramatic increase in the amount of money that the state pays on behalf of families.
And does DCF have any plans to index these rates for periodic adjustment?
I have a little bit later on, I have some information on that. Right now, we don't have a formal plan. We did do a study and a cost modeling that will give us the information that we would need to be able to do that well. So I've got a little bit more on that, and then that probably is a topic you guys are going to be interested in, and perhaps it will.
Probably bring it up and I forget the number up there, but
Yes, so.
there on the wall.
But the people who did that, the First Children's Finance, their national offices who did that study, and so you might want to hear right from them too. Okay, so rates increase. So at first I was talking about affordability for families. Now I'm talking about, the supports for childcare programs. It's sort of in my head, the way that I'm grouping these. So in terms of rate, we increased the rates. And then there were also direct payments to programs, right? So there was the readiness payments and ended up being a total of $21 million and was distributed between September 23 and April 2024. It was before the CCFAP changes kicked in and sort of after some of the ARPA stabilization payments had ended. So, and we got great feedback. I mean, programs loved it because we really just were like, here, we think you might know what to do with this money. And they really used it to support their staff, to invest in equipment. So there was that funds. Then this fall, we began to implement the Quality and Capacity Incentive Program, which is another element of the bill. And we got some stakeholder feedback. And there's a number of elements to this. So one piece of it, which I'm realizing maybe I forgot to put on the slide, was there is a little bit of money for technical assistance within this to partners in the state who are really helping programs achieve their quality and capacity goals, right? Without a little help and guidance, people weren't going to be able to take advantage of this. So we do have that support built in. But we also increased and refined our financial incentives for programs that participate in STARS. Again, that seemed important given that given the adjustment in the way that childcare financial assistance was structured. And an example in here. Like an example before was that maybe a center-based childcare program that increased to 5 stars used to get like $1,500, and now they're getting $5,600. And so we've now adjusted it so that it reflects the size of the program more. Before it was just flat by program type, whether or not you start with a program that served 18 kids or a program that served 80 kids. So we adjusted it to actually look at the size of the program. And really wanted to incent those programs that were increasing their STARS level, but also provide some support for the folks who are renewing, because we recognize that it's work to do the application. And that was a new STARS system that actually also rolled out in 2023 as well. So programs are really adapting to the new system as well, but we really think the new system is really focused on continuous quality improvement. It's really focused on the measures that we think are most directly tied to positive outcomes for children.
I have a question.
Yeah, can you talk a little bit about that incentive for STARS? What are some things that programs would use that money for? So it'll be helpful for us to understand, why should we give programs $5,000 to increase their quality, and how would that really benefit the kids and the families?
Yeah, I mean, I think it obviously the programs are able to use the funds as they see fit. But for something like something like that $5,000, that is often used for a more high quality professional development program. It could be used for mental health supports for the staff or for the children. It could be used for updates to their physical materials or higher quality materials than they would have been able to purchase otherwise. So it can really vary what they want to use it for.
I'm trying to figure out when's the right time to ask this
Okay.
question, and this might, may or may not be the right time, so. I kind of looked ahead to see if there was a plan to cover, and I don't really
Okay.
see it, so I'm gonna
Okay.
ask.
Yep.
And I know I'm opening up a can of worms, so I'm just putting that out there.
Yes.
So, so there is a proposal, from the Secretary of State's office and their Sunrise report around credentialing, staff who work in childcare programs, regardless of setting. And I'm interested in your thoughts about that.
Yeah, that's not in here. Okay, let's see. Well, I mean, so far, so CDD does not have an official opinion on this. And so I have not really, I haven't developed that with the commissioner and others. I mean, I think that what we do know is that the quality and the credentials and the experience of the people that are working directly with children is the most important factor for quality. The quality of the experience a child has. That's again, it's a proxy indicator, but that's how it works in a lot of things. We've got to come up with, it seems like there needs to be something. Right now, childcare licensing has credentials at different levels. We sort of have created we have a system to do it. I don't know that anybody thinks it's the best system ever, the way that we do it right now in terms of having individual levels for individual positions all outlined in childcare licensing regulations. It doesn't translate to other states for people that are either coming in or coming out of Vermont. So I think that we can see some, so it's just a different way to think about achieving that. And I can see that it could have some advantages. I also recognize that people have absorbed a lot of changes already right now.
What brought it up for me was talking about stars here and sort of the quality components. And, I know that, staff training and professional development and qualifications of staff all weigh into stars scores and things like that. And to some extent, at least.
Yeah, it's a little less, stars doesn't really look as much, does not look at staff qualifications anymore. We use class as an assess. I mean, it's a valid external assessment. Some other states use it as well. And we have external assessors that come in and look at different classrooms and make observations and use a tested tool. So that's one of the main things for evaluating adult-child interactions. Then we're also looking at how the programs use especially the Vermont Early Learning Standards, and how are they how are they embedding that within their practice. And then also looking at strengthening families, which is the family engagement framework that we've used, because we know that's also really associated with the quality of a child's experience. So it's those three frameworks that we're using. So STARS does not look at individual qualifications anymore.
Representative Steady?
So I'm reading, so I know what I'm saying here. Does the state, like a teacher that might be full-time during the school year, does the state have to keep paying during the summer to keep this full-time slot, even if they're home and the kids?
I am not sure I 100% understand the question. We wouldn't pay for, I mean, from CDD's perspective, we have, for the Child Care Financial Assistance Program, we pay for the weeks that the program is open. If the program has said that they're closed during those weeks, then they're not eligible for
Teachers that might use the full time while they're in the school year, but they don't work during the summer, let's say if the husband and wife. Does the program have to keep their slot? Do they have to say that their child is gonna go even if they don't go?
Oh, okay. So you're saying if a parent has like a seasonal service need, like it change, like how much they
Like,
care they
right.
need changes? I think I have to refer that to I need to ask my
I'm curious
financial
about that.
assistance person. I mean, we don't, people are allowed to have a temporary change in what their reason for needing childcare is, because you don't want to have those kids have to go in and out. And it's difficult for the programs to have kids go in and out. Like even now, like you're home on maternity leave, like you don't have to, like for 12 weeks, like we're not saying don't send that child to childcare anymore. Like, so, but I don't, so there's some accommodation there, but I don't want to
You
misspeak.
can get back to me.
Yeah,
And then, payments, do they go directly to the childcare?
yes, for a childcare financial assistance, they go directly to her.
Thanks.
Okay. So quality capacity incentive program, right? Financial incentives related to STARS. We also have bonuses for staff who increase their professional credentials in this. We were able to update those amounts for the first time in 20 years. So that I think felt pretty good to people that are working on support, especially for the educators themselves, but for the people who over the years have been supporting educators to advance their credentials. That feels good. So maybe moving from a $1,200 up to like $3,000 for getting a bachelor's degree in early childhood education and continuing to work in a regulated childcare program. And
You brought up
Yeah.
that, I'm just wondering, to what extent is DCS still supporting professional development?
Yeah, so we have a great partnership with the Community College of Vermont. They run our Northern Lights as our professional development hub. And yeah, that still is a very active part of what we do. We pay for that largely with federal dollars, with CCDF dollars, and support them both to do a lot of the workforce registry things, the things related to credentialing that's needed for childcare licensing, but also to do some of the fundamental trainings that we need that need to be out there for people that are working in early childhood and after school trainings. And then they also do, based on what they're hearing from the field, offer additional trainings on the topics that people are saying that they need support on. But they also, the people that process like you have to have a certain number of professional development hours. And they process like all of that documentation for people that work with regulated childcare. So that's a big part of it. Again, it's mostly federal dollars. But they're a big part of when they're the ones that are saying this person has increased their professional credential. They tell us, and then we're able to work to get the person, the support, the incentive that they've earned. We also have a new program bonus for programs that achieve specialized status. Specialized childcare programs are programs that are willing to serve children that have higher needs. Those could be kids that have children with special health needs. It could be children in protective services. But usually it's children that are vulnerable in some way and need some additional support. And often we'll also have some extra, they'll also be a little bit more complex in terms of working with the child and their family, but also often a caseworker or medical providers, other people will be in the mix. And so it's more work. But what we know about almost all of our early childhood educators is, they're in it because they want to serve children. Most of them want to serve those children at the highest need and be available to them. So we were glad to be able to provide that support for them.
How many specialized status programs are there out there?
I don't remember that number off the top of my head. It is a majority, I will say. I know that. I know it is a majority of childcare programs have specialized childcare status, but it still is, you want to have, ideally everybody be able to do this, because also you want to have options for families and options for kids. And you also want to, you don't want to concentrate all the children that need extra support in one program, right? We want to and then the final piece is developing an annual incentive payment that recognizes quality and priority populations. It was laid out in Act 76. We're in the process of developing what that would look like right now, thinking that the intention is to do something similar to what we did with readiness payments, where we developed a formula that looked at, but looking at data that we have right now, to then be able to make a payment out to programs. Again, sort of the intention there is to make up, is to make sure we're rewarding those programs that are investing in quality, since we didn't have it built into childcare financial assistance anymore. But also really those priority populations in terms of serving infants and toddlers, being in underserved areas, and serving some of those children with that need specialized childcare. Yeah. So that's in development and actively in development. Okay, so then the question is, so we've made those last two slides, right, were about investments that we've made in capacity. And so this slide is showing you capacity. And so, this slide does not have the same dramatic arc as childcare financial assistance does, right? This is going to be a slower, you're going to see change more slowly. And as we talked about before, it's also sort of there's change within these bars that's difficult to see, especially if programs maybe have had some cautious closing that are open again or things like that. So, because really what you see from this is really that childcare capacity hasn't changed that dramatically over this time. So I know that's not necessarily the popular narrative, but that's what the data shows.
So here's where, Let's Grow Kids puts out other data.
Yes.
That's not the same as this data.
Yes.
And so what's the discrepancy between, I know what their data says twice as many,
Yeah.
new spaces, but what's the?
So there's two, so specific to Let's Grow Kids, one thing is they were looking at 0 to 5 spaces. So you're looking at the school age data. So they would, so there's that's one part of why the information is different. And it also just really depends on what your start point and end point is. If you're looking at averages.
Well, this includes infants and toddlers.
It does. But sorry, which year you start, like what month you decided to start your count and what month you started to end your count. It could be, I've played with the numbers. It's a little tricky, but I decided that our data team just helped us decide that this was sort of felt like the fairest way to us to present the data. The other trick too is the question about programs that open or close. And so I think some of the communication has been about new spaces that have been created which is accurate. And there also were spaces that programs that closed during that time period as well.
I think that data is supposed to be, I think all the data we should be looking at should be net data anyway, in terms of, some that close, some that open. And I guess I'm just going to really encourage, and I don't know who is right and who's not right, but it's not really helpful to have different numbers floating around out there in very public ways. I'm just saying that. And so I'm really going to encourage y'all to come to agreement about what should be being said. And it should be accurate. And I realize it makes a difference between what time frame you start with. I totally get that. And it might make a difference between what's in development, so what might not be active yet, but,
Yes.
a year ago, I was in a classroom that was half built, it was going to have another 20 kids in it, but it didn't yet, stuff like that. So, it's just not really helpful, to have different numbers floating around for what to the general public appears to be the same data point. Yes, go ahead.
Just to confirm my understanding, when we're referring to capacity on this chart, this again is the licensed number of spots by provider.
Yeah.
So, and we don't know that, unfortunately, the system doesn't allow to see where there may be vacancies due to inability to staff.
Right.
We used to see that. We used to see like license capacity and then, utilization, your utilized capacity.
Yes. So you saw license capacity and you saw desired capacity. And working with our data team, we discovered that we felt like we didn't feel like the desired capacity data, that we learned that it was being entered into the system differently. And so And so we didn't actually have a lot of confidence in the desired capacity data that was being shared. We did provide new guidance to the people that enter the information into the system as of December. And so we are hopeful that we will get to the place of having some better desired enrollment data, right? Because it could be that you're physically licensed to be able to have 20 children in this classroom, but for your own educational philosophy, you decided we're only ever going to want 16 kids in this classroom or 14 or whatever it is. And so I agree, that's the information. We want that information. And we also want to know, is this classroom open or closed? And so we're working on refining that. And I guess I just didn't want to make too many promises about that being clean and available soon.
Go ahead.
So I guess I'm just, I like that we're investing in the capacity. I like we're investing in the workforce, but it's challenging if we're unable to find a way to see what the workforce picture looks like, to see which levers we're pulling are most effective until a new system is available that can capture that. Are there thoughts on how we can determine which lever is most effective?
So I think that the team the data team is pulling workforce data right now. So we do, out of BFIS, we do know how many people are working in the field. We have some information on their credentials, on their tenure. And so the data from December 31st, 24 has recently being pulled into the tables. And we can compare that. I think we typically do it every 2 years. So we'll have data from 2022 to compare that to. Again, it's a decent data research project to pull it together but we'll be able to, again, it's unfortunately a lot of the data we have right now is just it's directional. It's are we heading in the right direction? Do we seem to have more people? Do they seem to be more credentialed? Versus being able to really have say, here's our target. What are all the steps we're taking to, which levers are we pulling and how are we getting there? It's tricky. The data is tricky right now because we also I joke about how we pulled all the levers at the same time. So it's we don't know which one it is that made the biggest difference sometimes.
Well, and at the same time, you're implementing new data system. And so it's understandably complex in trying to determine what is causing what, or is it, is there some can we make some relational comments about, we increased, the rate that we're paying in CCFAP. And can you say that resulted in increased wages paid to staff? Well, Let's Grow Kids says it does.
Child Trends did do some focus groups this fall, and that is what they heard from the early childhood education program administrators that they talked to. They said, yes, we're using this money to increase wages. And I think that will be one of the questions that's in the survey that they put out to program leaders in the next couple of months. And they'll be able to say what changes, that will be one of the questions of so we'll be able to have a sense of that. And then the next step is you actually have to do an official wages and benefits study. The last one that we've done in the state was in 2020, I think, maybe 2021. So obviously we need to do another one. And it's planned and not it's this. Not done, not necessarily we're the thing to next year.
To be fair, we're still in the implementation phase. So, that's not necessarily expected. I'm just, again, we're in the position of having to judge data that we receive from different sources. And we receive data that says, wages increased X%. And I don't quote me on this because it's probably the wrong quote, but it was something in the 20-something%. And I'm like, okay, well, where does that data come from? You
Yeah.
know, it's
think that's a
stated
good-
as a fact. And I'm like, where's the data come from? And
Well, they might have it. I mean, you know, but I mean, between those organizations, they have access to programs and staff you know, and could have used their own methodology. So I just saying the state does, relative to wages, the state does not have updated data for you. Relative to licensed childcare capacity, here's data for you.
Yeah.
And I have a little data on programs over time as well, which I think is what people hear about, which is about the number of providers in this state. And so what this chart does is the gray line is the total number of providers. Green is licensed providers. Those are the larger programs. Those are the licensed, the center-based. And orange is the registered homes. And so what you can see, right, is that the mix of programs has changed over the years. You can sort of see that in recently, it appears to have stable after a sort of a after a decline, it appears to have stabilized in terms of, but the loss has been in family childcare homes. When you look into that data for family childcare homes, the decline we've seen in Vermont is in line with national trends. This is not necessarily a Vermont specific issue. And I think in terms of the national research and also sort of what makes sense in Vermont, it's really demographics. It's really sort of like a demographics issue, right? In terms of, right, the profile of somebody who starts a family childcare home, you know, has typically been the woman, a mom who has young children, who is married to somebody who has a steady job that can provide health insurance in a home that they own and feel confident staying in. And that is just not the profile of young people, like in, you know, anywhere right now for most people. And so that has been the trick. And so what we're seeing, it's not necessarily that family childcare programs are closing at a faster rate than they used to, is that the new programs haven't been opening, has been what we've been seeing. But this year was the first, we actually are seeing an increase. We actually saw an increase for the first time in many years of the number of registered family childcare homes. And we are seeing, in terms of, we support grant making through some of the, through federal funds as well as Act 76 funds to support capacity building. And they are receiving a lot of applications from people that are interested in family childcare homes. So much more interest in starting family childcare homes than there was in the past. Again, those sort of like big picture issues are still like relative to like what it means to be a young family in Vermont are still present, but we're seeing a lot more interest than we had before. And it does appear that the curve is turning on this one.
Maybe.
I really don't know how to write my question. So let's see if I can wing it. So for the state to give a provider monies, they have to be registered. It can't be just a pop-up home care, right?
Yeah, we have to, I mean, to run so for childcare licensing regulations, you're not supposed to care for the children of more than 2 families beyond your own. If you do that, you're supposed to be licensed. And when you become licensed, then you can have access to the state funding.
Okay.
Or registered license, you can have access to the state funding.
Okay.
We do have an approved relative childcare program that pays a small amount for a relative to be able to care for a child, but it's a non-parental relative. If there's and so for some families that ends up being an option that they want to pursue, the reimbursement amount is very small. So and many families value the communal learning experience that they're getting at in a formal childcare program, and that's what they're looking for.
So I know it's gonna seem like I'm harping on this.
Okay.
It might be. I'll just put that out there. My recollection around when, not this most recent change to STARS, but the previous change to STARS.
Yeah.
Happened about that same time, and when we had different qualifications for people. And the family home care providers had increased requirements and qualifications. all around that same time that we see a precipitous decline in those numbers.
Well, again, I think the numbers in Vermont are not different than the numbers you see nationally. So to point to Vermont regulations when it's the same trend you see nationally, doesn't add up entirely.
Well, we could have been different, perhaps. We don't know because that's not
true.
what happened.
But other states didn't, I mean, other states stayed the same and they also saw the same decline.
Right. Our reason for the decline might be different than what other reasons are. Maybe it's a coincidence, maybe it's not. But
Yeah, we changed I think that the last major update, was in 2017. But my understanding is that it had been declining long before that. It used to be over 1,000 damaged childcare homes in the state. So there was, I think, a little bit of my understanding. Yes, it was like slightly accelerated right around there, but then it seems to have, like I said, not been worse than it is. Okay. Those were my big data slides. So we can go to other things, I think. So just in terms of Act 76 updates, there's a bunch of changes, bunch of stuff in here. So these first ones, I just wanted to, especially because there's new members of the committee, I just thought I would make sure you guys knew that these were all in here, though I'm sure you've all read and studied the bill and annotated and everything. But again, and these ones, the first three, we just made those changes. We were able to sort of implement them by updating forms and applications, right? So limits on applications and waitlist fees for children eligible for childcare financial assistance so that those don't become barriers to families finding spots, making tuition rates publicly available. That will be even better once our IT system can be updated. But for now, they know that they have to do that. They have to share the information, and then providing ownership disclosure. And again, we already had ownership. We just updated the form that we had for ownership disclosure. We already had some of it, but we updated a little bit. Another change was around childcare financial assistance being paid on enrollment, and that attendance category should be minimized. We did develop a policy. We got feedback. We refined it. We implemented it, and it has. It's been a little confusing for folks. I think one is that people are confused by what we mean by enrollment. I think sometimes people think enrollment just means oh, I told you I had 10 kids and I got 10 kids. So now you just pay me for 10 kids. And you're like, nope. It's literally that specific child's enrollment who has been designated as being eligible for childcare financial assistance. So there's a little bit of that of trying to understand what does enrollment mean. We also did set a limit. We combine categories. So before you had to tell you that you were supposed to put in, was the kid sick? Were they on vacation? Was it unexcused or whatever? And we just said, okay, we're just going to just tell us that the kid's absent or not. And we set a limit of it on 30 days of absences, which is 6 weeks. And people have been really worried about not being enough time. Because there are kids who need to be absent more than that, right? If they're for illness and things like that. And again, we provide, there's been people who are really concerned about that. But again, we've looked at the numbers. Less than 1% of kids that are eligible for childcare financial assistance have hit that limit. We have provided extensions. We do provide extensions as soon as somebody tells us why. But we also have discovered that process has actually been decent from a quality control perspective, because it has allowed us to identify those places where it's oh yeah, that's right, they're not enrolled here anymore. Right? Or oh, we haven't followed that. And we reach out to the parent and they're oh no, I moved on. And again, it's probably, these things can just be administrative errors. I'm not saying anything different than that. It just is, or it's helped us identify oh, that they are having trouble getting to care. Well, maybe they need to be connected with specialized childcare and we need to figure out how we're supporting them with transportation. So it's actually been a decent tool. That said, we're going to have to change the policy again based on the new federal changes that are coming. But I think in general, I think it again, and the theory was really to also sort of not have to be in people's business quite as much too, of just they're absent, they're here, or they're not. I don't need you, we don't need to all know if it was vacation, right? And also you know, especially for families that have really limited incomes. I mean, you're like, where were you on vacation? And they're like, what are you talking about? I wasn't on vacation, right? Like they just have, their lives don't, you know, it's not how they're thinking about it. So, and then the other piece was related to annual tuition rate increases. And so, this, policy, or statute is prohibiting childcare programs from exceeding this cap on annual tuition rate increases. And so it's a variable cap. It's based on an index. It was in place. It got repealed last year. It's scheduled to go back into effect July 1st. This is a really tricky one. So I'm just putting it out there for you guys that it's tricky. I don't have a solution with me.
Well, more
So-
discussion. I think there's something in your bill about
Okay.
that. Yeah.
So it's sort of difficult for programs to, and it is tricky for programs to plan ahead. And it really impacts programs that are already established, not new ones. And it is tricky for CDD monitor. So that
Representative Steady.
yes.
Once you identify that a parent no longer has a child at that location and you paid probably for the last month, are they required to pay back?
Well, in this case, it would be the state who had paid, if the child wasn't getting the service, right, it was the childcare provider should have said they're no longer enrolled. And so we do recoup payments if we determine that it was kind of an improper payment for whatever reason, we do recoup payments.
Thank you.
Okay. Because there's so much more, I'll just keep going. Is that okay? So then there were other reports that were required. So there was a report on improvements to the background check process, that was submitted last year. Honestly, without really significant tech and staff and technology investments at VCIC at Vermont Crime Information Center, is going to be really hard to make any changes on improving the timeliness of background checks. And we are really bound by some federal rules that don't allow a lot of sharing. Our system in the state also, you know, the different fingerprint agencies in the state, some of them are sheriff's office, some of them are other entities. They all operate very differently. They all have different hours. So it's just we did do a process mapping in November. We're continuing to work on it. We do a process mapping exercise in November with federal TA, identified potentially a technology solution, I think. So we are continuing to work on it, but I just want to flag this continues to be a challenge. In terms of mechanisms to inform future CCFAP rate adjustments, we did commission a study and submitted a report last January. I don't think we didn't get a chance to talk about it last session, but it's there right now. Sort of the report outlines the fact that there sort of is a way to do this by looking at sort of what the market rate is, like how much is, you know, what are programs charging right now, or to look at cost of care. Right now, CDD did, again, as I mentioned earlier, work with Richland Finance to complete a sort of more of a cost of care type analysis. I have my next slide gives a little bit of information from that, but I think it's really relevant to what you guys are thinking about related to how one would think about rate adjustments for child financial assistance. So I have my next slide will come on that. But then, and then there was another report around streamlining and improving the effectiveness of special accommodation grants. We submitted that in September to you all. It outlined program expansions and process improvements. We really did make a bunch of changes to that program, including a longer timeline, more support for people who are applying. There does continue to be a little bit of concern around sort of the payment terms is what we're hearing from folks, and sort of availability of specialists and specialized services. But ultimately these special accommodation grants are a really important way to make sure that children can be safely included in childcare when they have special health needs or other real sort of that can include behavioral concerns. So when we relaunched the program, sort of in August, or since we relaunched the program in August, we have like 71 children in the state approved, and and the average grant amount was $22,000 per child, because a lot of this is a individual aid or somebody else, it's staffing. It's expensive, I guess, is what I'm offering to make sure that these children can be safely included. And that is one of our shared goals. And so right now that's largely funded with the federal preschool development grant. And then there's another report due in November. So going to this cost modeling report, and again, I submitted that. I think it's really well written. So even though it's pretty wonky, I think it'll be useful to look at. So again, we commissioned this report to model the cost of quality. I think it's also really important to know the caveats for this report, right? It was modeled on the best available data, and it made some assumptions about what typical programs are. We know that data needs to be all this needs to be sort of validated with additional input. Which was the intention, and that's already started at some of these conversations over the next 6 months to be able to update the model.
I have a question, Jim.
Yep.
Sorry, this is our budget area, so I'm using this opportunity to ask questions. So given that one of the findings is that the current rates for some programs, the cost for some program types, what is CDD's capacity right now to maybe increase rates for, if it's infants and toddlers? Do you have the capacity to do that by age grouping rather than I know we've done it in Act 76 by program type, but do you have the
technological capacity?
Yeah, well, if
technological capacity, yes. Megan?
Okay.
I would say that we haven't budgeted for that.
No, I understand that. Yeah. So I was trying to understand, what is are you capable of doing that?
So Ray went to the bottom line of this. So that's what it says, is that there are, right? It does look at current and aspirational wages. It tries to look at the rates and financial viability of programs. Again, it's an initial attempt. It needs to be continually validated, but I think it is useful, again, sort of directionally to think about things. And it does show that some state CFPB reimbursement rates support the model cost for some program types and some ages. So it is definitely worth looking more deeply at that report.
Yeah.
Just taking a little glance at it. Eyeball popping.
Right. So it is, but I think that's the key of, so that for that reason, I was I'm not going to even try to do it. I think you need the people who wrote the report, I think would be really helpful to hear directly from them. And I think the key to remember is that this is best available data and it's typical programs. And so it really matters what the enrollment pattern is in a particular program. And I think it also it speaks to what is the last slide here, is that the current CCFAP market rates, right, are based on the market rates. The market has not been particularly pegged to the cost of care for years, because preschool, the pattern in the market, right, is that preschoolers subsidize infant toddler classrooms. And so and the changes that were made in Act 76, right, were based on the rate patterns we had before, which were based on the market. And so if we just keep making changes off of the current pattern, we're going to perpetuate that. And that is something we should look at. So it's not probably, it's not like somebody's making bank. It's no, this is how it actually, what you would expect to see given the way the rates were historically set.
Right.
And I think that obviously we'd like to move towards what is a more accurate rate depiction, depending upon the age and the type of care that, different children need. And, we get into, whether it's in health insurance or whether it's in childcare, you get into some risky business when one group is subsidizing the other group. And so, but that means that one group's rates come down and another group's rates go up. I mean, theoretically. it doesn't mean that everybody goes up or just the lower rates go up.
Well, I think that's why it's interesting. The model does include looking at both current and aspirational wages.
Yeah.
And so, so that's that's some of the stuff to grapple with.
Yeah.
Right? And so it does sort of look at whether or not, and I know that a conversation has been about how do we address wages, so.
And I know that, you know, we had 2 hours on pre-K, but it's kind of hard to not talk about pre-K when we talk about childcare, quality childcare programs, because, you know, 60% of the folks who are participating in Act 2066 pre-K are doing it through the private system.
Yeah.
And so, and we don't really know what's going to happen with that, frankly. We don't really know what the governor's pre-K plan is really yet. And it wasn't provided in the information that dropped last week. So, you know, I just think it's an important element that's out there that is kind of swirling around without an answer. And other than what Secretary Saunders said at our you know, joint hearing with education, which was wanting to expand it for 4-year-olds and keep it the same for 3-year-olds. I mean, that's about what she said, but there wasn't really any detail to that. So it's a and with many things changing at the time, it then becomes I think incumbent upon us to carefully select any potential changes that might, you know, that we might consider as we think about what's in the budget. We think about what the sort of outside implications are. We think about what might happen in DC, what might not happen in DC. And it seems like a little bit of a weird time to be, I'm just going to make a statement and I don't expect you to respond or react, but it seems like a weird time to take general fund base out of a program that is still in the process of building its, you know, eventual path. You know, we haven't finished implementation of Act 76 yet. And I've been given the analogy of, like, you know, we have this box and we have 3 sides of the box built for the program, but we don't have the 4th side built. And the 4th side does include things that have impacts from the feds, like the 7% rule and understanding how much that might cost. And, you know, where are we going with credentialing staff or not, you know, or maybe some, or, you know, so those are still questions that are out there. And so then to take resources out of what's a pretty stable program right now, adding, I'll be honest, there's a lot of other unstable programs out there and a bunch of them are in DCF. And so thinking about adding to that potential seems difficult right now. You know, I think the timing, honestly, is just not right to be, it's one thing to be looking at BAA and saying, okay, we're not going to need it for this year, and here's a one-time adjustment, and we can do that, but cutting the base seems ill-advised at this point in time. Premature, yeah, premature. So I just felt like I needed to be on the record to say that, and I know you probably weren't expecting me to say anything different than that. Okay.
I'll just add that, you know, we do caseload adjustments for all of our caseloads every year in the budget, based on the data that we have and the cost per case. So it's not like we're doing anything special or like targeting CCFAP at all. It's just how we handle all of our caseloads across the board. And I'm sure, you know, you've heard me say a million times as I'm walking through the ups and downs, and this is a caseload adjustment. They go up some years and some years they go down, and that's sort of the flow of caseloads. So I would just put that out there.
Yeah, I don't disagree with that, Megan. I think that the parts that are still like to be determined are some of the new rules that we have to comply with, and decisions about credentialing and decisions about, you know, what kind of investments that might require. And you know, if we were like had the box all completely built and we're looking at caseloads up and down and it's an entitlement service. And so, yeah, I'd say, yeah, you know, it's not all things being equal yet, I guess. That's all I'm saying is that it's not we're not at the stage where all the box has been built around childcare yet. And there might be differences of opinion about that. I understand. So, okay.
Okay.
You have any other thoughts that you want to add, Jan?
I mean, so is it right? Because I think you started talking about pre-K too, and I would offer, I mean, I know you sort of said like, here's all the things we need to consider. And, I mean, I do think I understand that. I guess I would just say like, we're actively involved in the conversation with our partners at AAE around doing that modeling and figuring out what that cost looks like. And we have pulled the numbers on, like, I think it's maybe 700 kids that are eligible for childcare financial assistance who are also receiving Act 166 or Universal Kindergarten. So, I mean, they are connected, right? But, and I understand that if there's more hours, people's patterns again will change and things like that, but it's maybe the overlap might be a little less than what people think.
Yeah.
So, okay. So I wanted to give you guys this update real quick on where we are. But it is, right, so federally, the Child Care Development Fund, right, is what gives us some money to pay for some childcare in the state, but most of it is state dollars here. But they did roll out new policies. And this is a new rule that was announced in March 2024, and it went into effect in April. We were already in compliance with a lot of these elements. You can see the goals are there, and you can see that those are goals that we all share. So we had already done a lot of the things that were in there, but there are still some big changes that we have not made. And we did request a waiver for those elements until August 2026. So that's fiscal year 27. We are working together to develop plans for these 4 elements. So one is a requirement that we pay providers prospectively, so right before they offer the service versus after, which we know we'll have, we can figure that out from the finance side, but it also really will impact how we, it'll impact our record keeping within the CDDIS system, right? And how we, right now it's attendance that triggers a payment. So we have to reprogram the IT, and we also are going to need to figure out, update our program integrity, guidance, as well as our, how we audit programs and things like that. Because we're checking every pay period, or choose a certain number of programs, you check them to see, check attendance, do investigations, that kind of stuff. So, because it's a lot of money, we want to make sure it's being used properly. So we can do it, and it's just work. The payment by enrollment to providers, again, we have to use the federal definition, which will require a little bit of changes from where we are right now. Pretty close. So it won't be, but it will, again, it will require a little bit of IT updates and policy updates. It's requiring some grants, doesn't say how many, for grants and contracts for childcare services to support infants and toddlers, children with disabilities in underserved areas. So right now, all of the times we're directly subsidizing a child's participation in childcare, we are using childcare financial assistance subsidy payments the way it's implemented right now. This is saying we need to do it through a grant or a contract, which is there's just going to be a lot of work to figure out how do we decide who is eligible for those grants? Where do we target it? What does that, how does the information flow related to eligibility of those children? Like, it's just going to be, it's a big project to figure out how to do this in a way that's really going to add value for the whole system.
Mm-hmm.
But it could
intersect with this at all?
Well, the specialized childcare absolutely could impact it related to children with disabilities, and the special accommodation grants. I think that's really going to result in the fact that we're going to need to make some adjustments to what that system looks like.
Yeah.
But it could provide great opportunity to streamline things. That would be the hope, is that we're going to figure out a better way to do things as a result. And then the final one is a 7% cap on parent copays. Again, it's only required for those who are eligible for federal support, which is in Vermont is about 300% of the federal poverty level. And right now, for those families that are eligible for federal support. Almost all of them are below 7% right now. But there are a few, once you're at the 275% and 300% and some of the different family sizes, there are a few that are above 7%. And so we're still looking at what that would be. We want to create a system that makes sense, right? We don't want to create a cliff then, right, at 300% of FPL. And so we need to figure out a system that makes sense, that's understandable to people, that really doesn't raise copays from where they are. So it's again, it's a lot of spreadsheets that we've started, but we don't have, Megan and I don't have a number to share with you. We haven't had a chance to like really do the spreadsheets in a way that we feel confident in, and to be able, and then to also have that conversation internally within NHS. What we have done, though, is we put some initial legislative language right in motion. So that's the bill H248 that's on the wall, to allow to change the places where the statute needs to be kind of tweaked to support this. We are developing an RFP to hire a vendor to do some of the initial research and analysis on this, again, to do the detailed options for us, and look at what other states are doing, and to help us get to where we need to. We're also have started the process of working to hire an additional limited staff member if it's approved for to help lead this effort. Because again, it's just a big piece of work coming off of the heels of a lot of other changes that are still in progress. And there was some new money for childcare in the federal disaster assistance bill that passed in December. And so one of the recommended uses for that money is actually to help implement CCTF. So we're starting that process because there is some temporary dedicated resources that could be used for this. And then we have to do all the work associated with it. So again, I wish that we were further along with it, and it is tricky, as you were sort of saying. It was tricky to develop an estimate on how much these things cost when we're still rolling out other changes at the same time. We don't know uptake, and the team is really focused on making sure we get delivering our on the statute for Act 76. So I think that's what.
That was a lot. Representative Steady had her hand up, and then Representative Bishop, and then we're going to have to wrap up.
How does it work with daycares that offer pre-K education? Right now, we have the Vermont's Universal Pre-K program that provides the publicly funded $3,884 for 10 hours per week for 35 weeks. Does the daycare get that above and beyond what the child is paying for daycare?
It depends. So for private pay families, that amount of money is actually it comes off of what that family was paying. So it really supports affordability for private pay families. And then for childcare financial assistance, there's a couple, it depends on what the family's, on what's happening and with that family. We do look at that 10 hours is subtracted from what their service need is. So if the family is eligible for 45 hours a week, then you'd subtract that 10 hours, but that doesn't necessarily impact their childcare financial assistance payment, because the payments are usually it's full-time or part-time. So you could still be eligible for full-time, but that goes to in those cases, yes, the program often receives additional money, and it does cost them it costs them to be able to offer universal pre-kindergarten as well, because there's higher standards associated with it. So it's
there's definitely higher, you do need credentialed staff. In order to
Not all of them offer.
Right.
Yeah, that's right. So not every childcare program is eligible to be a pre-K program.
Right. Go ahead, Representative Bishop.
Back to the comments of Chair Wood in discussion about money moving out of base to come into compliance on the financial side of the 7% rule. Is that something where additional base would be needed, or is that part of the question of it's an entitlement, so it'll be covered? I mean, how does that get paid for?
So I would say that, again, like every year we reevaluate our needs, right? Based on our projected expenses, our known caseloads. So when we make adjustments to next year's budget, it's based on what currently is the law, right? And all of these changes for CCDF, they're not the law for next year yet. So we aren't building our budget with what might be happening in 27. We're building it based off what we think we know about 26. When we build our 26 budget, BAA, and our 27 budget, at that point, we would consider the changes that are happening and how we are going to address them. That's why we're doing all this work right now to kind of get that information, to gather the analysis, to get a contract for someone to do the math for us and give us options, so that that will help us over the summer as we think through what our budget submission for next year looks like.
And what,
That's the law now.
yeah,
It's not a future law, it's a law now.
It's not in practice now.
We have a waiver. It doesn't mean that doesn't mean we shouldn't be complying.
and the point of the waiver, I guess, how long can a waiver be in place and what qualifies the state for a waiver?
Yeah, I mean, we requested one and they said that the latest date that you could have the waiver until was August 1st of 2026. And we said we would like to put that on.
Thank you.
Thank you. Thank you both for being here this afternoon. And, I know that there's been an incredible amount of work to go into, when we pass a bill and it passes into law, and especially something that had this many moving pieces that went with it. And we tried to stagger them as much as possible, but still, they built on each other. And so it was a lot of work. It still is a lot of work. And we feel really fortunate to have you at the helm, leading that charge, because with lesser leadership, it might not have been as successful as it is and has been. So thank you very much.
Thank you. But it definitely was a full team effort. So.
Yes, definitely. So thank you both for being here. We appreciate it very much. And we're definitely not doing a 248B4 crossover, but we will take a look at it after crossover. Okay. All righty. Thanks so much.
Okay.
Okay, folks, we are going to now move to H91. And Alex has been waiting patiently. Thank you for being here. Seem like a regular now, Alex. So.
It's so nice to just see you. Where's the sidelines? Thank you so much, Roger.
Okay, will somebody grab the door?
So sorry.
Thank you.
No, Matt's just standing there looking down the hallway. That's all,
So I thought I'd put
I gotta
it.
tell him what to do sometimes. That's all that. Welcome. Thank you for being here. The floor is yours.
Great. Well, thank you so much, Madam Chair. I do want to just say a big thank you to you as well as the committee at large for your concerted effort to really look at this issue. It's absolutely critical. For the record, my name is Alex Brambliss. I'm a policy advocate with the American Civil Liberties Union of Vermont, the ACLU. We are an organization that works across a broad range of issues impacting the constitutional rights of Vermonters. And so I had sent over our recommendations that should be all posted on the committee page. And so first, I'm just going to share a little bit of context for why we care about this issue, and then I'll go into those recommendations. There is a lot there, so I just want to say, if it's the preference of the committee, feel free to ask me questions as I go along, if that's easier for everybody else. So just to level set a little bit here, we all deserve a safe and secure place to live, but for over 3,400 of our neighbors, access to reliable shelter is out of reach, and not for a lack of trying. Fortunately, we have a really wonderful opportunity right now with H91 to ensure that our neighbors who are unhoused can remain safely sheltered while the state works towards long-term solutions this legislative session. And so I'm not going to get into the context for, how exactly we got to this moment in our crisis, but I do just want to emphasize that research really does support the conclusion that housing availability and affordability, not, prevalence of mental illness, substance use disorders, poverty, or even service availability. It's really that housing piece that accounts for homelessness trends over time. As affordable housing scarcity affects all of us, it disproportionately impacts people with disabilities, families, older Vermonters, and other vulnerable members of our community. Unmanageable rents force more people into homelessness each year and really limit the odds that those already unhoused can find shelter. This in turn, as I know you all have heard through the testimony that you've received, cause immense suffering, distress, and a real critical lack of safety for those who are impacted. The ongoing mass sheltering in our state is deeply troubling to the ACLU on several fronts. Not only just because it's a denial of the basic humanity and dignity of our unhoused neighbors, but because we are an organization that advocates for evidence-based solutions to the root causes of harm in our communities, including mass incarceration and homelessness. Investing in the short and long-term solutions to our crisis can really preserve the health and safety of Vermonters, not, criminalizing folks who simply have nowhere else to go. We know that when people are unhoused, they are far more likely to become victims of crime. And we also know that people who are unhoused disproportionately suffer from a disability of some kind that requires support. All too often, symptoms of these disabilities lead to adverse outcomes, including hospitalization, being removed from shelter, and sometimes even incarceration. Tragically, because of the 80-day limitations to our GA housing program this past fall, at least 7 Vermonters have lost their lives, and at least 82 people have died while experiencing unsheltered homelessness over the last 4 years. Their deaths were predictable and preventable, and we must collectively create policies that value the lives of people experiencing extreme hardship. Importantly, the ACLU of Vermont, we believe that eliminating unsheltered homelessness is an achievable policy goal. And we just really applaud H91 for stating that intent. So I'm going to jump into the recommendations here and just say, to begin with, the ACLU of Vermont supports the calls from providers that, like I said, we've been hearing over the last couple of weeks, that there should be parallel action. The backdrop of this program is critical. And we think that the state cannot build up an adequate solution with the chaos of unsheltering people happening simultaneously. That causes providers to be focused on keeping people alive and not solutions for housing. And so we think that there really can't be a tapering of the GA program until it's matched with permanent housing and shelter that can meet need. We fully support the recommendations of the GA task force. And I did forget to say in my introduction, I also wanted to give a special thanks to Representative McGill for your work in that body. And, just to kind of underscore that the state is unable to produce affordable housing at a fast enough pace to remove the need for emergency solutions right now. So the recommendations I'm about to walk through, they mirror the task force recommendations as well as other solutions that we think could be incorporated into this bill. So the first one here, we think that we should ensure all Vermonters experiencing unsheltered homelessness have access to emergency shelter. Housing is a human right. All individuals experiencing homelessness deserve access to support that preserves their humanity and dignity. So we really encourage lawmakers to ensure that core services are being designed to support everyone and not, just those that might fit perspectives of who is deserving. While this is particularly true during the cold winter months when risk of dying by exposure is imminent, threats to health and safety exist year-round for all homeless individuals. So we support H91's efforts to ensure that there's some relaxed eligibility during the winter, but we just would encourage it to be a little bit more explicit with the way that is currently written. Another additional needed component would ensure that an adequate number of emergency shelter operations are developed, specifically serving individuals excluded from the GA housing program who don't meet that criteria year round. there is no other current plan in place for those folks. And so accordingly, we think that shelter expansion should complement GA program refinement in the bill. Sustainable funding for community-based programs should be designed to ensure geographic and population equity. Examining this issue from a system-wide lens can provide needed resources to support historically underfunded shelter providers and other supportive services. So this includes independent advocacy from statewide organizations for individuals accessing shelter or housing and living with complex needs. As we've heard, this constitutes a really vital function in our system and is currently unfunded. And so lastly, we also want to encourage the legislature to consider shelter expansion should really prioritize models that follow housing first principles. And I'll get into that later on. But another point I wanted to make is just we really encourage lawmakers to limit the expansion of seasonal or short-term systems that are unable to house people for the amount of time that it takes to secure housing. I'm going to go to my next recommendation here, which is we think authorization periods should be tied to long-term housing availability. So as it's currently written, I know that there are limits up to 45 days and 90 days in the bill. I just want to say, we oppose limitations of that nature to support the capacity of community shelters, to make sure that policy investments solve homelessness. We think that qualifying beneficiaries should be granted shelter until homelessness is resolved, or at least have it tied to data-driven estimates for the amount of time that it takes to secure housing. If individuals are forced out of shelter prematurely, connections to services dissipate, housing opportunities dissipate, and then without, resolving homelessness, individuals exited from programs are far more likely to face catastrophic outcomes and a longer length of homelessness, and thus reliance on shelter support is likely to extend for a much longer period of time. This cycle really works against policy goals of decreasing demand for emergency shelter over time. Once authorization periods are set, we think that those participating in the program should not have to periodically reapply for the services that they're already receiving, be moved from location to location, or be removed from the program due to arbitrary capacity limits. I know a lot of these challenges were addressed in the bill as it's written. We do recommend using a different metric than the one than H91's 45 and 90-day limits tied to vacancy rates. Specifically, we recommend using a HUD system performance measure, and this is listed in my testimony, as well as the GA task force recommendations that more accurately predicts the amount of time it takes to find housing. Additionally, one last point on this piece is we think that the adverse weather conditions period should be expanded to align with the Vermont State's parks closure, more closely mirroring the time that Vermonters have deemed appropriate to exposure. The next recommendation here is to enhance statewide planning. So we think the state should establish some data-driven benchmarks and perhaps habitability standards for new emergency shelter beds. Really think that this can help connect aspiration to clear and achievable policy goals. As an example, I know Oregon has been doing this. They've identified a specific number of beds to come online each year, and something like this, I think, could serve as a roadmap for Vermont-specific solutions. We also think that, and just echoing a lot of the testimony that came before me, streamlining existing data sources across state and community systems can support planning efforts. So we recommend that all relevant departments and contractors operating within the Agency of Human Services be directed to engage with both HMIS and the coordinated entry system, working to reduce those wait lists, maybe utilizing AHS staff to support provisional case management. And then, some of those elements that I previously spoke about, benchmarks, funding, should be integrated into that system as well. Monthly reporting can enhance this in terms of planning and transparency. And so there was just a few more items that we would recommend being included into those monthly reporting metrics already in the bill. They're all listed here, but it includes households eligible but not able to be served due to room capacity, the number of available motel rooms, and then to the extent possible, the number of households exited for certain reasons. Another recommendation we have is to prioritize non-congregate shelter solutions. Having access to privacy within a shelter is critical to allow people to feel safer when they sleep, provide a space for people to store their things, reduce the spread of illness, help prevent further trauma or violence that might be more likely to occur in crowded congregate spaces. I think what is helpful is that, Vermont was one of many states that utilized motels during the pandemic, and it kind of provided the natural study conditions to understand how that affected outcomes. And so in the testimony that I've sent to you all, there are some links in this section that links to some of the studies that I'm referring to. And what they found is that non-congregate shelter, it increases individual stability. It reduces the need for emergency health services, creates positive health and social outcomes, and just overall better housing and general well-being outcomes for folks. Something else that we thought was a really important opportunity for us all to consider, and I know this was in the GA task force recommendations, but considering the conversion of motels into permanent housing, there is precedence for this in other states. California and Oregon have done this, and it is essentially allows a state to make a single investment that provides access to both emergency and permanent supportive housing. We also think that a program such as this should allow access to comprehensive case management. We think that services should be, robustly available but not required. And so this includes both, housing navigation, but also, addressing the underlying barriers to housing, whether that's childcare, transportation, employment, or, treatment. And so these services, we want to emphasize that they should be voluntary, individually tailored, and available both on-site and in the community, and should not be tied to their shelter housing. So not a prerequisite for someone to be able to remain sheltered. We think these services should omit practices that are not grounded in evidence, such as forced treatment. And I also think that this could be a really great opportunity, language-wise in the bill, perhaps in a definition section, to add some more detail to what that case management should look like. Perhaps it would be helpful to outline for provisions or minimum quality standards, and just really ensure that those services are client-centered. We also recommend allowing participants to save their resources. Required contributions, so things like income-based payments, they really prevent people accessing that service from saving the resources they need to move into an apartment once it becomes available. There's costs like security deposits, moving costs, furniture, kitchen supplies, and other basic needs. And it's really critical that individuals can have their own resources available for those needs when housing becomes available to them. And so we think that this bill could be strengthened by either, prohibiting income tests or income contributions from participants. One of our recommendations, and I know that this is something that you heard quite a bit about from Vermont Legal Aid, I thought that they did a really great job talking about this issue, but ensuring that reasonable accommodations can be made. Just to reiterate, their points, people with disabilities are protected from discrimination and exclusion of housing, publicly available accommodations, and state programming through both federal and state law. And this includes people with psychiatric disabilities or people with substance use disorders. Additionally, the law requires that reasonable accommodations be made when, for any rule, policy, practice, or service that might be necessary for a person with a disability to have equal opportunity to use and enjoy a dwelling. Equal access for individuals with disabilities cannot be circumvented by program implementation. And future iterations of this program really must ensure compliance with these critical laws. Also just want to point out that, GA program requirements centered around accepting alternative shelter housing placements must ensure that those placements are accessible to people with disabilities, don't mirror the harmful legacy of institutionalization, and comply with the Olmsted decision. To that end, any plan to build up shelter beds for a specific population should focus on the particular beds and not separate facilities. And so we support and uplift the recommendations from Shelby LeBaron, Vermont Center for Independent Living, and Homelessness Vermont, as well as the task force recommendations. We also think that a way to strengthen the bill is to limit capacity for rulemaking. We found that rulemaking facilitated by the administration has placed funding consideration over the health and well-being of Vermonters by requiring income contributions and instituting population prioritization categories that were really not authorized or even contemplated by the legislature. To ensure that we don't see this happen again, we think that rulemaking authority should be as explicit as possible, including prohibitions on rules that limit program accessibility. And so this should include the prioritization of subpopulations, limited windows to call for services, denial letters and appeals processes that are not defined or placed in writing for participants, and then rights related to reasonable accommodations. And then lastly, I know I spoke about this earlier, and I know you have heard about this quite a bit throughout testimony, but we really encourage the legislature to adopt a housing first model, for this program and for really anything else that you might be contemplating as you look at the larger system. Housing First provides immediate and unconditional access to housing and support services for individuals and families who are experiencing homelessness. It's both a practical model and an ideological principle that acknowledges housing as fundamental to all other aspects of life. This approach has been supported by decades of research showing widespread success, particularly for people with substance use disorders, mental health challenges, those with disabilities, and individuals with a high level of criminal justice involvement. And so we recommend that the state continue to develop a system of permanent supportive housing using these principles. So just to close, we really do applaud this committee for its efforts to ensure that this program is shifted from a benefit negotiated every year into a program with defined expectations. And so we really stand behind the large community of people with lived experience of homelessness, service providers, and other advocates asking for bold transformational change and adoption of housing first principles in our policies.
Thank you, Alex. And thank you for providing your testimony in advance.
Of course, writing. Did my best.
Are there any,
You can write right off. Yeah.
are there any questions for this witness? Thank you very much. We
Thank
very
you so much.
appreciate it.
Appreciate you all and the work
I
you're
like the
doing.
way you did the links.
Oh,
I'm already in
fabulous.
them.
I'm so happy to hear that. Thank you.
Yeah, I like the
Representative.
links.
Thank you, and thank you for following along with our work as well. Appreciate it.
much, Madam Chair. Appreciate it.
Okay. So, 3:00. We've just been sitting through a couple hours of testimony, and I just want to do a check-in. Tomorrow, we are making some budget decisions. And I'm wanting to check in to see if anybody needs any assistance. For the BDH team, you have a new spreadsheet, okay, to take a look at that I think should be helpful in helping us sort of like put our hands around everything there. And we do have Dr. Levine coming in tomorrow. So he's coming on 218, but we can ask him anything related to the budget and all that kind of stuff. So he'll be.
Okay.
218 is the opioid
No.
bill.
Here.
Okay. I saw you place him first, yeah.
We've already touched base, but so.
Okay, any,
It's looking for it.
you can touch base again, we're done.
Yeah, so I'll just say, given that the cost modeling report that Janet talked about, we just found out about this weekend. So I think that has shifted personally my perspective about what our recommendation's going to be. So we're gonna do some work with the business office to try to find out if they can get us modeling of like what the cost would be, because I think thinking about that gap and what you pointed out so eloquently that, if we raise everybody's rates, then that's going to keep perpetuating the gap. So thinking about how do we reduce that gap, if we have an opportunity to do that with this budget. So we're going to be working with Megan. I gave her a heads up when she was here.
Yeah.
So we don't have like numbers on what that would mean if we only raise rates for infants and toddlers, which is what my mind is going to.
So, and I think, as I think about, sort of the structure and what we might say in our budget memo, we might not have the specific dollar amounts that are necessary, but we know the elements that need to be addressed.
Yes.
So those are all things that we know. So, I think that we understand that we have to live within a budget, but we also understand that there are certain things that need to be dealt with that are in process. And, I just want to say this out loud. It doesn't make sense to me to reduce a budget that you then have to ask for an increase in next year because you already have the money this
Or
year.
in 6 months.
In 6 months, it's not even,
Yeah.
So none of that makes any sense to me, and it is current regulation. It's not like it's not a law that hasn't been passed. It's gone through the extensive Federal Register process that Ann knows very well. I mean, you don't get federal rules passed like that.
Yeah.
They go through years of implementation and public comment and state comment and, so that's problematic. So I guess what I'm saying is like, I don't want you to feel compelled to have to identify specific amounts
Right.
for specific elements, but to identify all the elements that still need attention. And then I think, we'll make some decisions about what the total amount is or not.
But
So,
I do also, on record, want to give the department credit. They have given us a lot of information.
Yeah.
that we've asked for in a quick turnaround.
Yeah.
So they've given us what we asked for. We just didn't know to ask about this because we didn't have the information.
Sure. And then, go ahead.
I guess I'm just curious for our global committee discussion on this. It's challenging. I'm wondering where we all stand with putting it into the document we ultimately want it to be in. So that we can
It
sort
should
of,
be tomorrow. It should be in a document that we can all share. So,
okay,
we've had 2 times of sort of sharing verbal reports. Tomorrow we need to have a written report that will be in, and I see we have a super, high achiever here. She's already started her draft.
Well, no. It's not in the format it's supposed to be. It was kind of informationally updated.
Yeah. So we need a written report tomorrow so we can see that. We're going to be making decisions tomorrow. And then tomorrow is the official due date, but I'm going to stretch it. I'm going to stretch it a little bit. We have like, some places only have like one part of one department and we have 3 departments and one of them that is big enough that it should be 2 or 3 departments. So we get a little bit of leeway. So anyways, just so you know, that's why we'll finish here pretty soon, but written recommendations tomorrow. And even if we are not changing them, but we may have language for something. So I'm thinking about Dan and Todd on this. There's big money for nursing homes in this budget. And so we should reference them in our chart. Okay. And I am going to send Katie some draft language request. has everybody, I know Ann's team has gotten some language. Does anybody else need language? I know you're gonna need language. So we'll I'll help you with that afterwards. Yeah,
Yeah, I
okay.
need to follow
Got
up
it.
if you want us
Figured out.
to judiciary language.
Okay.
Just anybody talk.
Okay. All right. So everybody clear? So we're making decisions tomorrow, at least the first round of decisions. We'll look at it again on Thursday before it's final. And then we need any language. You need a draft of your written report. Okay?
And would you like that sent to the committee before, like? tonight?
If you have them and you've already worked on them, send them to the committee. Yeah, just put out to House Human Services, and Lori is on our listserv, so you don't need to copy her separately, because then she gets it twice. Or you probably don't get it twice.
That's good to know.
Yeah, so I just saw somebody had sent something to House Human Services and CC'd Lori. I'm like, Lori's already in House Human Services. Okay, all right, so I think everybody knows what they need to do, and I am around for a bit before I have another meeting, and so